we want to start by introducing the members of our panel. I think we've got 5 panelists from a variety of the health science backgrounds. And we had, so I'm going to go ahead and ask the panelists, maybe starting with Brendan, to go ahead and introduce yourself, say your name, what year you are, your major, and your program. So hopefully people can find, and pay attention to the fields they're particularly interested in.
All right. Hi, everyone. All 167 of you that I can't see. My name is Brendan Coyle. I just recently graduated from Wayne State University in April with my bachelor's in public health. I'm pre-physician assistant. I'm currently on my 2nd cycle of the CASPA application. So I am very experienced with both interviews and rejections, as well as everything pre-PA. So for all my pre-PAs out there, feel free to target any questions at me when we get to that time. What else do I need to share?
I think we're good. We're good.
I think we're good. Okay.
Cool. Sarah, I'm going to bump it over to you.
Okay. Hi, guys. My name's Sarah Elias. I'm going into my 3rd year here at Wayne State, and I'm a biomedical physics major. I'm also pre-med, and I think that just about covers it.
All right. Lauren?
Hi, everyone. My name's Lauren Cole. I'm going into my 2nd year in the nursing program. I am also part of the Student Nurses Association on campus as well. And yeah, that's all about me.
All right. How about John?
Hi, my name is John Carnes. I'm also a pre-med, just like Sarah. I'm a senior as a biochemistry and chemical biology major. And yeah.
Oh my God. And then Kareem?
Hey everyone, I'm Kareem Garib. I'm a 3rd year public health major, and I'm pre-dental.
Nice. So we tried to get kind of a variety of backgrounds, because I know so many students come in and sometimes you might switch things, you might always stick with what you wanted, but there's lots of different ways we support students. We tend to say pre-med all the time, but we don't just help pre-med students. So if anybody has, we are still working on the live caption and on the attendance link, but we're just going to go ahead and start getting questions. Like I said, please feel free to drop questions in the chat, and otherwise I'm just going to start with a list that Amanda and I made up ahead of time. Yes, this is for pre-nursing too. Lauren Cole's pre-nursing. Okay, you guys, how did you pick? I wrote down major. How did you pick your major? But how did you also pick the professional path, like nursing versus PA versus med versus dental? And did you ever change your mind along the way? Anybody?
I can start.
Okay.
So I initially came in my freshman year at Wayne State as a biology major, and I changed after 1 month of being a biology major to public health. In 2016, the public health program was brand new. So I was like one of the first 100 to declare public health. I just kind of wanted something that I could more practically, like it was something more tangible, I guess, that I could definitely immerse myself in the Detroit community as a public health major. Physician assistant, I decided probably just right before I got into college, just through exposure at my primary care provider's office. I enjoyed the way a physician assistant practiced. I felt more understood by a PA over my MD, just given my past medical history and stuff like that. So that's what kind of exposed me to the PA field. And then once I started working in the hospital where I currently am, I gained more exposure to the PA profession and fell in love with it. And that's why I'm here today.
Okay, I guess I can go next. So I have always had an interest in the medical field. Never really had an exact answer though to what I wanted to do. So I kind of bounced between pre-med, pre-dental, literally everything here. And then I started to actually shadow downtown at DMC Children's, which was a really great experience. I had probably the best time ever. And I really got to see kind of hands-on what the nurses do. And that really inspired me to go into it. So that was just kind of my awakening moment. After that, I was obsessed with the idea of being a nurse and hoping to even possibly become a nurse practitioner later on. But yeah, that was kind of my aha moment, and I stick with that. So.
Can I jump in really quick? If you're looking for the closed captions, there is a link in the chat box that you can click and it'll take you to the closed captions. We're trying really hard to answer all of the questions in the chat, guys, but we may miss some of them, so just be patient with us.
Yep. John or Kareem, anything to add? Different, same?
Yeah, kind of a similar situation for me. I was originally a biology major, but for me, why I changed to public health, it was a lot more involved in like things and going on in Detroit and in my community. And it felt more personal to me to take classes like that than like just studying fungi and plant biology and things like that. So in correlation with the prereqs for dental school, I'm also a public health major. So I'm taking like what's required for me to apply to dental school while also getting a public health degree. So it kind of works out for what I'm interested in.
Yeah, I chose biochemistry because I felt like I wanted to be I decided when I was in like high school that I wanted to become an anesthesiologist, and I felt like to better understand both biology and chemistry for that means, I decided that biochemistry would be a choice that would be very suitable for what I wanted to pursue.
I think one of the things that's really important to notice too is everybody's bringing a different background into different fields, and there's no one right path for anybody. We're going to jump to something from the chat, which is probably the #1 question we've been asking and asked all summer, which is, how do you stay engaged in COVID? How has COVID like impacted your professional school preparation? How have you managed to stay engaged in things? What kind of tips could you give for freshmen coming into this new world? It's like a double new world, right? Like pandemic world over here plus college. What can you do to help them figure that out?
I guess I'll put some input in. So obviously I have graduated, so I don't really know how everyone's classes are going to be and stuff like that this fall. But there are still ways to get involved in the community, especially as a pre-professional student. I know there's still many volunteer agencies that are looking for people to actively volunteer throughout these harder times. I don't know if someone's unmuted, but
Yeah, everybody's supposed to be muted.
I don't. But sorry, I got a message right there. But I would just look into community organizations and stuff that are still seeking volunteers. And as far as like studying and stuff goes, you guys will probably have a lot more time to kind of hunker down, given that there's not a lot of social time that you guys will have with groups and stuff like that. But I might be wrong.
I guess I can kind of add on. So for me, obviously things happened last semester, and it was my first semester of clinicals. So it was kind of a weird adjustment. Our clinicals were cut short, unfortunately. But fortunately this semester I get to go back, so that's awesome. But I would say with everything going on and everything being online, again, time management is like the biggest thing. It's up to you to kind of make the decision on how on top of your game you're going to be. Because now, especially with it not being in person, it's more left up to you because no one's going to be there to remind you, every day, or, you're not going to see your friends every day in your classes. So I would definitely recommend just like getting a planner, finding things that'll help you kind of stay on track with what is going on in the class and when assignments are due and everything. Because I think that's going to be the hardest thing about everything being online. And then also just kind of keeping your motivation. Again, it can be hard, especially like because you're not seeing people, like it is hard. I mean, it's motivating to see your friends and like want to do better and everything. So also finding motivation is going to be a little bit more difficult, but you still have your friends there. You can still reach out to them. So I think those are probably the two things that I struggled with the most, for sure.
And just to bounce off of what Lauren was saying, now is a perfect time to use what Wayne State gives you. There are plenty of amazing resources through the university that you can use to your advantage to make sure that you're successful. Talk to your advisors. If you're taking some STEM classes, talk to your TAs, make some study groups. You can go on Zoom to study together, whatever you need to do to make sure that you're successful. Wayne State has those resources. So make sure that you guys are taking advantage of them. And if things are getting kind of stressful, because this pandemic is like, it's new to all of us. So a lot of us are struggling with it mentally. And if you feel like you're struggling with it mentally as well, go to CAPS, go to whatever you need to do to make sure that you're okay mentally and that you're like taking care of yourself before you take care of your school.
Adding on to that, so I know that as like a pre-health professional, you want to do things related to your career of interest, but I'd encourage you to get involved in the community in different ways. For instance, I lived on campus my first 2 years. I loved it, and that really sparked my interest to get involved within the Detroit community. And so I'd encourage you to try to get involved with the community. There are actually many remote virtual opportunities available now, as clearly this pandemic will be here for a while. So there are more opportunities as that happens. And honestly, check your email. Wayne State posts some really important emails, and I know you can get overwhelmed with all the emails and you may just want to delete it or not even look at it, but I really encourage you to open it. And even if you're not really interested and it's remote or something, just click on it, and you can leave if you're not interested, but you never know what you'll find. Like things come when you're not looking for them.
I'm going to pause this before we jump again.
Thank
And
you.
we're just going to say, if the attendance worked, awesome. If it didn't work, don't worry about it. It's not a big thing. We're just going to let it go.
Thank you. I was
So any other questions in the link? John, did you want to add anything on this sort of?
Yeah, I was going to just bounce off of Sarah, what Sarah said. And I was going to say, like, there's plenty of, like, the best thing about Wayne State is its location in the heart of Detroit. And there's a lot of organizations, there's a lot of volunteering clinically and non-clinically to help with the downtown Detroit / midtown Detroit area. And I feel like that's kind of why you go to Wayne State, is you can engage with the community and really understand and talk to different people and backgrounds.
So were any of you engaged with research when this started? And if so, did it impact what that looked like?
I can speak to that as well.
Yeah.
While I'm on. So my research, I had a couple projects going. My chemistry research ended up being temporarily shut down. I had another project, the scholarship called I think it's the Barber Research Fellowship thing, and that was continued on during the summer. But currently, I just got the okay today, technically, to start maybe cycling back into research, but that's very regulated right now because of the fact, because of the pandemic and such as that. They're very strict on who can come back, and yeah, it's not an easy return right now. So
I also did the barber program. I did it my freshman year after summer, and I really liked it. And then so I've stayed in that lab actually, and I'm also in a lab at the School of Medicine. And so when the pandemic hit, like, that was pretty difficult, but both of my labs actually transitioned to a virtual setting. And honestly, I've been able to really hone in on my skills, such as reading journals, looking for journals, interpreting studies. And I think sometimes we tend to overlook those things. We want to work in the lab, we want to be hands-on, and all of that is wonderful. It's so much fun, but those are also important skills that you can elaborate on. And so I'd encourage you to try to get involved in research, even if it's virtual, because whether you're in person or remote, there's going to be a lot of kind of, I tend to call it dirty work, because as an undergrad, that's what you're going to do coming in. You're not going to be given these huge responsibilities. So I might as well get started remotely. But the fact that this is a pandemic, medical schools or any professional school will keep that in mind when looking at your application. So don't put yourself or anyone else at risk. It's understandable.
I can talk. So I was lucky enough to graduate in the pandemic. I don't know if it was be considered lucky, but I was actually finishing my thesis through my research lab the last 3 months. So like when everything went into shutdown over spring break, I was actually in the middle of finishing my thesis. So it didn't impact my research too much since I was heading my own project, but I know as a lab, it was definitely difficult just because canceling like participants visits and stuff like that kind of throws a wrench in research, especially if it's like participant-based research. And I know a lot of, I'm gonna Laura, I know a lot of people are asking, like, how do you get involved in research? So I'm going to answer that question. So as a freshman, it's hard to get involved in research. Correct me if I'm wrong, other students that are on the panel. But I applied after my freshman year to a lab. Most want you to be in school for a little bit and kind of get some labs want science requirements to be completed before you go into a lab. But most, if you're looking, interrupting myself here, if you go to UROP, undergraduate research opportunities, that's where you'll be able to find labs and stuff for research. And I know someone targeted a question at me for pre-PA. You do not need research for PA school. I just did it because it was something I was interested in. But feel free to, if you want to get into the research realm and it's a task that you want to tack on to your already growing load as a pre-PA student, go ahead. But getting involved with research, just go to UROP Connect. I don't know if that's still an active website, but uropconnect.wayne.edu, and that'll show you active studies that PIs are posting if you want to start getting involved in research. But I would start looking probably after your freshman year, after you get settled a little bit.
Changing topics a little bit, there's a couple of questions that kind of relate to the major and planning and getting all your prereqs in. So none of you have a major that lines up exactly with the prereqs for the program you want. Almost not even Lauren, because you had to plan certain things on the way in to do that. And you may end up doing a minor or something along the way because of the way the nursing program is structured. So how do you go about meshing your like degree requirements with your prerequisites for your program, since no major does it all?
So with pre-nursing, basically how it's set up is you kind of come into like Wayne with like a major, and then you have a track called pre-nursing. So pre-nursing isn't a major, it's a track that you follow. And basically you have to just get like 8 prerequisites in, you have to get some requirements in, so you have to get community service done. They call for like 10 hours, but you can do a lot more. I personally think like it looks better. Not to say that they will pick someone with more hours over someone with the correct amount, but I personally think it just looks better for your character altogether. And they also look at letter of recommendations, as well as your personal statement, which is a huge thing. So for me, it was just kind of tying in my community service work while I was still trying to get into the program, because again, to me, I think that's a big thing. The more experience you have, whether it just be like volunteering in a hospital, the more you get to talk about, and the more you can express how you really, really want to go into the field and what you've experienced. So I think experience is a big thing going into really any major within the medical field, because it can show that you've been there, you've done something, you've been interested in something, you've wanted to help out, instead of just like, oh, well, I got a 4.0 in this class. Great, but you have to have like the people skills and the motivation to do things. So for me, it was community service. I really tried to tie that in with everything that I did. And that really helped me move along for sure.
Anybody else on this idea of, planning your prereqs along with your degree requirements and all the extra stuff?
So Laura's probably very familiar with me trying to figure out my pre-PA track. So PA requires a few different classes that pre-meds don't require. I know it depends on the school, but there is a general layout that Wayne provides, but they primarily go off of Wayne State's program for the prerequisites, which I found out later in my college career that there's other classes that I should have been taking that I would add on. So I would take a look, if you're pre-PA, start looking now at schools in just areas that you are thinking about, because the Wayne program, the Wayne layout is a little different, because some schools may require genetics, some schools want Gen Chem 1 and 2, some schools want Orgo 1 and 2, some want physics, which I did not take Gen Chem 2 or physics or Orgo 2. So it limited the amount of schools that I could apply to. But there's also some schools like if you're taking Gen Chem 2 at a different college, it might just be the other half of our Gen Chem 1, but Gen Chem 2 at Wayne State is analytical chemistry, which is insanely hard. So you might not want to put yourself in that situation where you're taking analytical chemistry over an easier sequential part of Gen Chem 1. So it wasn't the most clear-cut path for me as a pre-PA student, but I ended up taking classes at other universities and stuff like that. I just finished a post-bac class a couple weeks ago at OU just to up my GPA a little bit. But definitely consult with your pre-med advisor or your general advisor for your major and just kind of get a layout and start thinking about that stuff now.
Yeah, I was just gonna say, just to use your advisors. They're really the best resource you can use. Like Laura and Amanda, they're some amazing people. So you really need to use them as much as you can. I honestly
Did
feel
not
like
pay him.
Amanda.
That's what I was just thinking.
Yeah. So, but for me and any other pre-dental students, like in the meeting, there are a lot of like prerequisites for dental schools, especially the two in Michigan, U of M, Ann Arbor, and UDM. And those prerequisites, some of them line up with like a bio major, but you're also going to be taking classes with a bio major that you won't need for dental school. So that's what kind of convinced me to change from a bio major to a public health major, because I'm, first of all, more interested in public health. And I just need to get my prereqs for dental school to be able to apply. And you also don't even need a degree to apply to dental school, but I want my public health degree, so it works out for me because I get both of the things that I want.
I could not agree more. I think that your advisors are like essential to planning any coursework or any track for medicine. Like I was bouncing between Amanda, then my assigned advisor and my major, and jumping back and forth, making sure everything's figured out for all your classes, because that's what they're there for, is to help you. So I mean, use them, utilize them. They're resources with the university. So schedule appointments. That's the biggest thing they're there for.
Yeah, it's true. And it gets a little stressful, I think, scheduling appointments. Like everybody, they're all laughing because they've all been in that position where like they want a question answered and they can't get it right away. So every week our office hosts drop-in advising. And that can be a great way just to check in and get a quick question answered. And then some of us this next week, as you kind of look at, do I need to adjust my fall schedule? Some of us are offering drop-in advising on Zoom. We'll see how it goes. Hopefully it's useful. Usually first week of classes, you can turn up and ask questions. But it's not abnormal to have to wait like 2 to 3 weeks, depending on the time of year, to get an appointment. So if that's what you see out there, just take your appointment, and then sometimes you can move it up, but just get that appointment on. Yeah, and we want you to meet with an advisor by sometime during your first semester. So keep that in mind too. I'm trying to see if, are any of you honors college?
Yeah.
Okay.
Yeah.
So looking at how has being in honors impacted your ability to be a successful pre-health student, I think is kind of what we're asking.
Personally, the honors college, it really helps you integrate within Detroit, and you learn a lot about the history of Detroit. You learn a lot about how that impacts communities in many different aspects. And I think having that understanding and also that like broad appreciation for the city, and even you do learn, I don't know about like the descriptions now, I know they change it, but we also had kind of like a political science, like government class. And that was never something I was interested, but after taking that course, like we went to Lansing and we met with like representatives, and that really sparked an interest for me in getting more involved with current events. And I think while it may not be directly linked to healthcare, those are things that are very important that you should know about if you do want to be a practicing healthcare provider or professional.
Also, there are honors advisors that are really good, and they'll help you out. I keep reiterating, you got to talk to your advisors as much as you can. Like, just, you're not bothering them because they're there for you. So just make sure you're talking to your advisors. But also, I know for like dental school, I'm pretty sure it's similar for the other pre-health. If you're involved in your community and you're not just focused on your school, but you're involved in your community and you're volunteering and you're in the honors college, it'll only help you. Like, it'll only show that you're not just about your track, but you're also about helping your community. And I think that like med schools, dental schools, PA schools, they appreciate that and they'll take that into consideration when you're applying.
Yeah. So somebody asked, what are the kind of things you would go ask an advisor about? Like, what should you expect to talk about in that meeting?
This is a loaded question. You should talk about everything. You should tell them about current, so, you know, if you're pre-med, you should talk to them about scheduling for MCAT, taking your MCAT, what prep to do for the MCAT, your scheduling for classes, you know, scheduling for classes for everybody, obviously. You should talk to them about volunteering. You should talk to them about shadowing. You should talk to them, literally everything under the sun, you know. It's their job to help you, and, you know, are privileged to listen. So they're full of information, and that's kind of, you know, the give and take, but you gotta, sometimes they'll tell you things like you need to shape up, and they should, because you need to hear that sometimes. So
That's usually
Yeah,
my job.
Yeah, I was gonna say Laura will tell you how it is. But I mean, I'm partial to Laura. I probably saw Laura probably 3 times a semester, but don't schedule yourself that much. Don't overload her schedule. I mean, I visited my public health advisor like probably once a year, just because public health is easy to schedule on your own. Figuring out those classes and stuff, but I would go see a pre-health advisor when you have questions. I mean, for my pre-PAs, like, what type of certification should I be getting to get my patient contact? Like, what works best for your schedule? Planning out your prerequisites, like when you're going to be taking those. When it comes time for GRE prep, and I know I'm hoping I get in this cycle so I don't have to take the PA CAT, but the PA CAT is going to become a thing. So my pre-PAs out there, start looking at that, because you're going to have to start studying like MCAT studying, and it's going to be the PA CAT. So that's going to be something. And then when it comes time for interviews, you can schedule a mock interview with your advisor, and they can drill you on those questions. So all good.
Also, sometimes we don't talk about classes. Sometimes we talk about dance,
life.
right,
Yeah.
Lauren? We might talk about dance. We might talk about cats. We might talk about all sorts of stuff. So, yeah. I've gotten distracted here. That was one of the ones that we thought of ahead of time, which yeah. If you could go back and give yourself one piece of advice as a freshman, what would it be?
I guess I could pipe in. So for me, I would say don't let the little things get to you. Adjusting from high school to college is a big adjustment, and it can be hard for some people and it can be easy for some people. So the thing that I would think of is just don't be too hard on yourself. Life happens. It takes time to adjust, and I don't want you to like beat yourself over grades that aren't so nice looking. It all happens. Like, I didn't do too well in a couple of classes and I'm still here in the program. So as long as you can convey your desire to be into the program that you want to be into, or you can convey that you want to be a medical professional and this is the reason why, and you do well in other aspects, they can always overlook the bad grades. So again, like, don't beat yourself over like things that can't really change, but also try your best. I'm not just using that as like, hey, you did really poorly in this class, but it's fine, you might get in if you do again. So just kind of don't beat yourself up, but also work as hard as you possibly can. Things happen, grades can kind of slip sometimes. That doesn't reflect you as a person. Stuff happens. So just want to put that out there.
Kind of in light of what Lauren just talked about, my high school AP Calculus teacher always said, and it will always forever stick with me, fail faster. Something she always said in AP Calculus was to fail faster, because the faster you fail in something, the sooner you can figure out what you're doing wrong. So if you're struggling with those intro science classes, if you're hitting that wall, that first test, that first exam, seek the help immediately, because the faster you're failing, the sooner you can figure out what you're doing wrong, and the sooner you can become successful in that class.
And just another thing to add on to that, it's also important to be prepared to change your plan. Like if you meet with one of your advisors this first semester and you like schedule a plan for what you're going to take each semester until you graduate, it's not going to stay like that. Like it's going to change, and be prepared for it to change. I had a plan. I've had like 17 different plans. I couldn't even tell you how many plans I've had, but plans change, things happen. It's okay. It's not that big of a deal. Just be prepared for it to change, because it's honestly a good sign that it's changing, because it shows you're still on the right track. And it shows that you're putting in the effort to make sure that you're meeting what you need to meet in order to be successful. Like last year I took Orgo 1 and it kicked my butt and I had to drop it and I was petrified. But I changed my plan. I'm still pre-dental. I'm taking my DAT in January and I'll be just fine. So don't sweat it. Just be prepared and you'll be fine.
Thanks, Kareem. I appreciate that idea that it's okay to change the plan.
Laura would never let me plan more than one or two semesters in advance. So Kareem has a point.
Yeah.
I was just about to agree too. I was like, I took the MCAT as a sophomore and wasn't happy with my score. And I had to replan another study semester, which is a lighter load. So I had to push back. I was going to try to graduate in that 3.5 years instead of 4. And I pushed it back to 4. And you just kind of have to accept that, you know, like do what's best for you. Know that sometimes it's better to go slower, better to take your time on things, especially if they're harder or something like that. Like plans change.
Yeah, absolutely.
I would probably say like let things happen. I don't mean like sit back and just like do nothing, but when I was a freshman, the summer before classes even started, I went to my major and I went to my major advisor, and I think I went to Laura, and I had everything planned for the 4 years. I knew everything I was going to do every semester. And then I tend to be very controlling, I would say, of myself, not others. But if something didn't go my way, I would get super like frustrated. I mean, not like outwardly so, but I would just be really unhappy, and I couldn't really think, like in that moment, I couldn't think around it and problem solve and see how petty things were. And that's like when I would have to go to my mom would be like, Sarah, like chill. And I've told Laura this, like she knows this. So, I mean, it's very natural for pre-health students to have a mentality like that. And don't beat yourself up about that kind of thing, especially with the pandemic. Like, yeah.
It's true. Yeah. How about one of the things I always love about Festival and O2 and the coming to campus is you find all these resources that you didn't even know were out there, and you walk around and you go to the tables. Even Amanda and I do this. We like table shop and we see who's doing what's new, what's going on campus. What's your favorite resource on campus and why or how have you used it?
I'll say my favorite resource all 4 years of undergrad was the law library. I don't know if the libraries are open. You guys can inform me if they are. Okay.
They are.
The law library is the best place to focus, because if you breathe too loud, someone will look at you. But it's just if you enjoy a quiet space to study, I thoroughly enjoy the law library. And of course, my favorite resource will always be the PreMed Advising Center.
For me, my favorite resource, which kind of ties on with the question that was just asked about the paper that you have to write to get into nursing school, my favorite resource was the Right Zone. It's completely free. It's included in your tuition. Basically what it is it's just a bunch of graduate students and students who are majoring in like either communication, journalism, English, anything like that. And basically you can take your essays or anything you have and they can read over it with you and kind of help you develop it more. So for me, when I was writing my personal statement to get into the nursing program, I kind of had like a good idea of what I wanted to write about. I kind of wrote it out a little bit and then I brought it there and they helped me rearrange it and kind of come up with other things to touch on. So that's definitely my favorite resource. I've used it a couple times, and I definitely recommend it to everybody. Again, the Right Zone is just like a center that you can take your essays or lab reports or anything to that has to do with like writing an essay, and they help you kind of tweak it a little bit and make it better. So I definitely recommend it. It's free, so why not use it?
I'll go in a little bit of a different direction. I think one of the best things to engage with on campus and resources would be the resources of like student organizations and stuff like that. You guys have a ton of different places to socialize or try to engage with others that can support you and have similar interests as you. There's whatever programs. There's a ton of clubs for that, such as like Pre-Professional Medical Society and a bunch of different clubs. Like there's American Chemical Society for chemists. There's all these different organizations that are there to help you. They're there to support you. They're there to, if you're having a hard time, they'll, tutor you a little bit, go to Peer Mentors is another resource. There's a lot of opportunities for growth, and there's a lot of resources at Wayne State to utilize.
Yeah, I know for pre-dental students, there's the Diverse Dental Society, and there's plenty of other like pre-health organizations you can use. And they'll really just help you find like ways to do research or ways to volunteer, and just it's a great way to get involved in your community and to also build your application and add things that will look good on your application. Another resource that I talked about earlier was CAPS. That's a great place to go if you just like you're stressed out, you don't know what to do, you need someone to talk to, a safe place that you can talk about whatever it is that has you stressed or down or depressed, whatever it is. Because obviously we're living in a pandemic and it's kind of crazy. So it's nice to have that resource and that safe place to talk to someone. So CAPS is definitely something I would recommend as well.
Thank you, Lauren. I got frustrated with all my tabs. Are you gonna round it out?
Oh, you go ahead. Go ahead.
Okay, I was just gonna say, we are running out of time. So the first thing I wanna do is thank our panelists. This is a really excellent panel, actually. I feel like I wish we could duplicate it. Oh, Sarah just put some stuff in there. Thank you. If you have not already and you would like to meet with a pre-med or pre-dental advisor, please make sure that you plan on attending one of our info sessions, because we are going to refer you back to that. And I'm dropping in the chat right now the Pre-Med Health Science Center website so that you can sign up for an info session. We're doing them all virtually, so you don't have to come on campus for them. So there's, you don't have to come down there if you're not taking any classes on campus. I am supposed to remind.
There's also pre-nursing essentials. The nursing essentials meetings are also on that link. So the only people we don't have special meetings for, because we're going to send you over to the college, is anybody who's pharmacy and pre-health sciences. Yep. So our PAs, our PTs, our pharmacy. But yeah.
Yeah.